Do you have any loss of hearing?
Like all good primary care doctors, Joseph Mambu is part specialist.
X-ray of that shoulder.
And orthopedist 1 minute,
The heart is a little on the fast side.
cardiologist the next. But Dr. Mambu does not get paid like a specialist. On average, specialists make twice as much as primary physicians. A starting cardiologist with 3 to 5 years more training makes up to $350,000 a year. A starting family doctor, $149,000, mostly because family doctors aren't paid for time spent counseling patients.
The only way doctors get compensated are by doing something to the patient.
To the patient, meaning some procedure.
Exactly. Nobody values what primary care doctors do. That's why we're in the crisis situation we're in. Your hemoglobin now is normal. So
Dr. Mambu is part of a national experiment called Medical Home, which increases the pay and power of family doctors. His practice gets a 10% bonus, and he's hired extra nurses to stay in close touch with patients, handling the details of care.
No more Advil. Your creatinine is rising.
This frees him to spend more time with each patient, better manage their chronic diseases like diabetes, and helps them avoid extra trips to specialists.
Under this experiment, you get paid more. How does the system save money?
Unnecessary and unwanted care no longer occurs. I can't tell you how many people will get referred that wind up being worked up and really didn't need it.
But as the system begins to pay primary care doctors more, the pressure is on to pay specialists less.
Medicare just proposed a pay cut of up to 40% for specialists like radiologists and cardiologists, and pay increases of up to 8% for family doctors. Specialists predict the cuts will reduce their service in rural areas and still not raise enough money to recruit more family physicians.
Does this get us to more primary care doctors?
No, absolutely not, because there's not enough. The cuts to cardiologists are devastating to them. It's not even close to helping primary care in the way they need to be helped.
Now, that back pain of yours, you doing any stretching for that?
And without more help for family doctors, healthcare reform could make the crisis worse. If you think it's hard to see your family doctor now, imagine what happens when 45 million uninsured Americans start to enter the system.
Hold your breath.
Wyatt Andrews, CBS News, Philadelphia.
And hold your breath.